It's 9:15. Happy Wednesday to you. It's the 6th of May, and we have got Dr. Nijam in the studio.
T32 Dental Group. This is his second time chatting with us.
Good morning,
and
Gerald. Good morning, Sophie.
Such a pleasure to have you back.
Great to be here. Thank you for having me.
Since we last chatted, right, there's been an update, okay? Of course, you see patients every day. Gerald actually brought his daughter to see you. She had what?
Yes,
a cavity or
I don't think there was. I was just a little bit
No, there was a
Nijam, was
cavity.
there?
There was a cavity,
Okay.
but a small one, but
Okay.
definitely needed some attention. But she was so good in the chair. I mean,
I was shocked.
She was so well behaved. She did amazing. Like
Okay.
most kids are like frightened to come to the
Yeah.
dentist. She was like a natural.
Well, maybe
She's
I need
really
to bring
good.
my children to you.
No,
too,
Dr. Nijam
'cause
is
they're
very-
giving me some trouble.
Dr. Nijam is very calm. He's got a technician there who gave stickers. So, of course, Gemma is like, okay, I'm okay to be here.
Okay.
Daddy, Mummy didn't even need to be in the room.
Before we segue into what we want to talk about
Yeah.
today, can I ask you, what is the earliest that you want to see patients coming to the clinic?
So the general guidelines is usually about 18 months, but when they have their first tooth. But to be honest, we want to see them as early as possible. So even sometimes like infants who find it difficult for moms who find it difficult to breastfeed their infants, sometimes there's something called a tongue tie or a lip tie. And this makes it difficult for them to latch on to their moms.
So you're saying you specialize in this?
Yeah, so we do. That's a procedure that we do. We have a team that does this as well in our clinics. So that's something that really can benefit a lot of moms out there.
Right.
It's all related. And you know what I noticed going through this parenthood journey myself is when they're not eating solids and just drinking milk, I associated it initially with they don't need to see a dentist. But it's not true because any kind of milk has a lot of sugar in it. Is that true?
Yeah, that's true. But see, there's different types of sugars, and it's the form of the sugar that is really important. So if you're looking at foods, they are candy, ultra processed, the sugar is very different. You know, you get a very big glucose spike in your body, and they're usually very sticky. So sticky foods like chocolates, candies, biscuits, they tend to have a higher potential of a child getting cavities compared to natural sugars or natural foods.
Well, I didn't know that. I just thought sugar was sugar on the... I didn't know the tooth knew that this is, for example, like I give my children a ton of fruit, okay, and it's got a lot of fiber and good things, and I also brush their teeth manically. So far, so good. But then I considered that to be the same sitting on the tooth as like a piece of candy, and you're saying it's not.
Yeah, so exactly. So even though sugar, there is sugar in fruits, but because it has got water content and because it's got fiber, the body doesn't see it the same way. So the sugar, the blood sugar rise is not as dramatic as compared to if you're eating a candy bar.
Well, I'm learning a lot.
In terms of fruits, right, there is like acidity in the fruit. Will it hurt the enamel or,
So that's an interesting question. So I had a patient who used to drink a lot of lemon water. They would squeeze lemon in warm water, and there's a lot of health benefits to that. So I've heard that is good. But you want to neutralize that acid in some way, because for his teeth, it kind of like worn down the teeth. You kind of, it's like erodes the teeth. We call it dental erosion. So you don't want to be sucking on a lemon. You don't want to have that acid lingering in your mouth for long periods of time.
Okay.
So what you want to do, if there's a lot of health benefits to drinking warm water and lemon juice on an empty stomach, but you want to neutralize that by just giving it a quick rinse with water.
Got it.
Just to neutralize the acids.
It's so funny how people are trying to do something extremely healthy, and there's always a drawback to every habit. So I think that's something to take note of. Can you touch on some foods that are good and some are not so good?
I mean, in terms of a general statement, we want to stay away from processed foods as much as possible. So anything that comes from a packet, generally we want to have less of it. Anything that comes from the earth, that is grown naturally, we want to have more of those. So like kind of like an 80-20% rule. We have 80% natural foods, natural whole foods, and 20% of our candies and things like that.
So processed food, for example, meats in a can, how does that hurt the teeth?
Meats from the can, processed foods, they do a lot of harm to the body. So there are a lot of nitrates in these processed meats. They're usually preserved, and generally they're not very good for your overall health.
Right.
They're not very good for your gut microbiome. So we have a oral microbiome, we have a gut microbiome. So these are live bacteria that actually help a lot with the processes of maintaining your healthy teeth, healthy body, healthy brain functions. It's all interconnected.
Right.
Yeah.
So if you're not giving the good healthy food to this microbiome, the gut microbiome or the oral microbiome, then it's going to affect a lot of processes in our body.
We eat in balance, right?
Eat in balance, yeah.
We'll try. I have a question. Okay, when someone comes into clinic and is there a way that you can tell the person doesn't eat well, or do you just tend not to guess and not say?
So interestingly, we're like the detectives of the mouth, right? And the minute we see in someone's mouth, we can tell their diet.
This is
we
making
can
me
tell
scared.
their quality of sleep, whether they're getting good sleep,
It's worse
poor
than a
sleep.
fortune teller.
I'm so scared. I'm so afraid right now.
We're looking at the tongue. We're looking at the teeth. They all tell a story. They all tell a story
Wow,
about
so
your
it's all
lifestyle.
going on in your brain, because I'm guessing you're not like, whoa, you've been bad. All right, keep your questions coming through. I want to ask you something a little bit about fruit. Okay, Gerald actually, surprisingly, he eats a lot of fruit.
I love fruits.
and it's well, I consider to be a health food. Can you touch on that? It's sugar. I know it's sugar, but can you talk about fruit?
It's sugar, but like I said earlier, there are different types of sugars. And if you're going to snack, I'd rather have my kids or myself snack on a healthy fruit rather than reaching out for a candy bar. So if we need that sugar high, we need a little bit of a pick-me-up. I'd rather be having a fruit, a whole fruit, rather than a candy bar.
The sugar in fruit is called fructose, right?
Yes, it's
Yeah.
fructose.
And you're saying together with the fiber and the water content, it's actually like a superfood.
Yeah, exactly. So it acts like sometimes a prebiotic for your gut health, for your
Okay.
gut bacteria. So it's a lot of benefits to eating fruit. So 2 to 3 servings of fruits is definitely something that is well recommended.
Okay.
Is there a fruit that can wash your teeth? I heard from somebody that eating apples can actually maintain good, I guess, like the whitening of the teeth. I
Well,
don't know.
okay, so if you have fruits that are crunchy, crunchy fruits, they tend to stimulate more saliva. And saliva flow is like your natural mouthwash. It's like your body's way of producing a mouthwash.
Oh.
So anything that you're eating that stimulates saliva is where you're crunching and chewing and stimulating saliva. It's like it naturally cleanses your mouth. So whatever
Wow.
acid that remains, it gets washed away.
It's like a superpower. I need to debunk something before we go for a break. Okay. I love
okay.
my mom. She's always telling me that certain fruits are really bad. Can you debunk this a little bit? She says, stay away from that. That'll do this to you. And then it makes me nervous to eat what I usually like. Is there a rule on this? Is it not true?
To be honest, offhand, I can't think of a fruit that is bad for your health, to be honest.
Mom, you're wrong. She's going to be angry at me.
Wait,
I
I'm
can
trying
tell.
to think as well.
She said
Durians are good, right?
She said
Durians good.
bananas. She said
Bananas are-
mangoes, but I love them.
I think from a health point, like we hear of heaty foods and non-heaty foods. So I think if you are, like TCM talks a lot about this, right? If you're taking too much of durians, maybe it's too heaty. I think there's some truth in that. So
Okay.
everything in moderation.
All right.
But yeah.
Wow. I love to learn about
Dr.
this.
Nijam, I want to ask you, is it true that these days dentures are not as sexy as before? Like people don't opt for that?
So in general, it's a big lifestyle switch. The minute you're on dentures, you go to a restaurant, there's certain foods that you may not feel very comfortable chewing on. And that's a big lifestyle switch. So most people can get used to dentures, but it will never feel the same like how it was with your natural teeth. So the closest thing that you have to replace it will be an implant. But like I said, not everybody is suitable for implants. Sometimes it's the cost. Sometimes it's the fact that they've lost a lot of bone structure, so they're not suitable for implants.
Hey, what's the price like? When you want to do implants, do you count like number of per teeth?
Yeah, so it's usually okay. So it depends. It depends on the
Per
condition. Sometimes it could be per tooth. Sometimes we can do sections of the mouth. So it's
Okay.
very, you don't need. Just because you have 20 missing teeth doesn't mean that you need 20 implants.
Can you give us a range for money?
So it can range, like per tooth can be about 4,000 to 5,000.
Whoa,
And
guys,
so
brush
if
your
you
teeth.
have
Just
like,
give me 4 teeth. That's enough.
yeah, if you have like a full, like for someone who's lost all their teeth, it can range from anywhere between 25 to 50,000 or more.
Dear.
Wait, there's no insurance for this?
Yeah, I was going to say
You
the
can
exact
use,
same thing.
You can use MediSave. There are some procedures you can use on MediSave.
Okay.
But it's like almost like a home renovation, to be honest. It's like
Or
we're
more.
really doing a
Think about
renovation
how
for
many
your
bags
house.
I could buy with that. Okay, so I think the parting message should be, right, because we were talking about this. Once it gets to that stage, often you have to act and it's a little bit too late. But if you are heading towards that, it's just best to take care of the teeth that you have. Do you have a parting message for tips for this, or what do you want everyone to know?
Yes, 100%. So no matter how good dentures can be, no matter how good implants can be, they will never be as good as your natural teeth, right? So we can do really beautiful dental work, but your natural teeth, that's going to be the ones that you want to protect for the longest time.
Okay. But with that said, there's still help if you do need,
course, yes.
like help for teeth and everything. Well, Dr. Nijam, once again, thank you so much for joining
from
us.
T32 Dental Group. You can visit him there. I'm sure he'd be more than happy to help you.
All right.
Thank you very much, guys.
We hope to have you back again.
Thank you so much. Thank you so much.